All right. Good morning, good afternoon, everyone. Thank you for joining us today, another AHEC Health webinar series. We are really excited to come to you with our newest webinar, Bolstering the Indigenous Health Workforce. We have three really great panel presenters here with us today. So we're really excited to share with you. We have three wonderful people here with us today. Grace Burns, who graduated from Carroll College with a bachelor's in public health and sociology and holds a master's of public health, health systems management and policy from the Colorado School of Public Health. Grace oversees the health equity related work at the Montana Office of Rural Health and Area Health Education Center at Montana State University. Her work includes task force work, health equity training, and the Health Equity Assistance Fund. She has worked at the intersection of rural and health equity for nearly a decade. She also works on the Montana REACH grant. In her free time, you can find her hiking, fly fishing, or listening to a podcast. Jeff Axtell. Jeff Axtell is an Arizona native who attended Northern Arizona University, where he graduated with a Bachelor's of Science in Healthcare Administration. Jeff furthered his education by attending the University of Arizona to obtain his master's in public health community education. Jeff started his healthcare career in Bisbee, Arizona, where he was the deputy director for the Cochise County Health Department. Jeff joined the Arizona Advisory Council on Indian Healthcare in April of 2022 and currently serves as the director of the American Indian Health Area Health Education Center. AIH-AHEC program activities include community-based experiential training for college students in health-related disciplines, youth pipeline healthcare activities for grades K through 12, continuing professional education for primary providers working in tribal communities, and a community immersion program for graduate students in healthcare fields here. And then our last panelist today, Gloria Burnett. Gloria Burnett is the director of the Alaska Center for Rural Health and Health Workforce and Alaska's AHEC program. The center is located at the University of Alaska Anchorage and is composed of a program office and 6 regional, I think it's AHEC, centers located across the state. Gloria has over 14 years of experience in healthcare workforce development, youth career pathway programming, and health continuing education. Prior to her current position, Gloria served as the Dean of Students at Ilislavik College, Alaska's only tribal college. So a huge thank you and welcome to all of them. So with that, I'm excited to pass it over to our panelist presenters today.
So I just wanted, before we jump into this presentation, the one thing I wanted to share with you all, it's really fun for me to be a part of this because it's where the two AHECs meet. I'm aware of the American Indian Higher Education Consortium. Was heavily involved and continue to maintain partnerships with Ilislavik College. So I greatly appreciate tribal colleges and all the work of AHEC. And I've been also part of the other AHEC that some of you might just be hearing about today, the Area Health Education Centers. It was another AHEC program that's also a federal program that's a nationwide program where we are actually focused on healthcare workforce development. So this is really, really cool to bring you all together, have the AHECs collide and be able to share some of the great work we're doing. And I'm very hopeful that this will spark some interest in some potential future partnerships between our organizations in the future. So thank you so much for having us here today. I have invited colleagues from Arizona and Montana to be a part of this panel with me. And we are going to be tackling this topic of bolstering the Indigenous health workforce through examples. We really want to share a little bit more about our organizations, what AHEC is, how we might be able to partner and support the wonderful work that all of you are doing specific to healthcare workforce development. So the question that we get a lot is, what the heck is an AHEC? So I decided to just start right there and just provide you guys kind of a big picture overview. As I said, Area Health Education Centers is what AHEC stands for, and they are federally supported programs that support development of healthcare workforce with a special focus on rural and underserved populations. We're funded through the Health Resources and Services Administration, and Our mission is to enhance access to quality healthcare, particularly primary and preventative care, by improving the supply and distribution of healthcare professionals through our partnerships, through community and academic educational partnerships. And without partnerships, AHECs would not exist. We need partnerships. They are the foundation of the work that we do. And you'll hear that theme again and again as we begin to share some of our work with all of you. So each one of us is going to take a moment just to give you a snapshot of our state and who we serve and what our regions look like. The model of the AHEC program from the feds requires that there's a program office that is hosted within either a school of medicine or a school of nursing. It's part of that federal legislation that we must follow. So the eligible applicants for AHECs are schools of nursing if you're in a state where a school of medicine doesn't exist, like Alaska. So we are funded through the University of Alaska Anchorage. And then once we receive those funds through the School of Nursing, we have to distribute 75% of our funding to our regional centers. So the model really is community centric. Most of our funding goes out to our community partners. In Alaska, all 6 of our regional centers that you can see here on this map, they serve very large geographic regions. And many of these regions are not connected by road systems. So it's very difficult to travel from place to place, especially if you look at that red section of the map. Our Northwest AHEC is a good example of this. They're hosted by a tribal health corporation, Norton Sound Health Corporation out in Nome, but they're responsible for serving Uktiagvik, and they're responsible for serving Kotzebue, which are 3 very separate communities that are not accessible by roads. So just to give you an example of that large span. We have 6 regional centers in Alaska. The interior AHEC, that tan, like light white color in the middle, is currently actually in the midst of a transition from the Tanana Chiefs Conference in Fairbanks to Foundation Health Partners in Fairbanks. So we're in the midst of a transition right there. The Yukon-Koyukuk AHEC, or sorry, Yukon-Kuskokwim AHEC is that blue colored region there in the corner. That is served by the Yukon-Kuskokwim Health Corporation, another tribal health entity. Our South Central AHEC is hosted in Anchorage by the Alaska Primary Care Association. Our Southeast AHEC is hosted by a nonprofit, CIRC, Southeast Regional Resource Center, and they do a lot of work in the education system. And then also the Southwest AHEC is hosted by the Aleutian Pribilof Island Association, which is another tribal health organization. So we really do value our tribal partners, and we build our community partnerships with those specific entities in order to better serve those rural populations. All right, I'm going to hand it off to our next speaker, Jeff, who's going to talk to you a little bit about Arizona.
All right. Well, hello, everyone. My name, again, Jeff Axtell. I'm the director of the American Indian Health AHEC. So for our AHECs in Arizona, it started out that there were 5. And you can kind of see them. They're kind of like Alaska. They're geographical. They're all kind of defined by county. And so for many years, since I think, back in the 1980s, there's been an AHEC in Arizona. But what recently came about, and it really kind of stems from our parent agency, the Arizona Advisory Council on Indian Healthcare, in that one of their strategic plans was to establish their American Indian Health AHEC solely, just focusing on American Indian Health. So went through legislation a couple of times, didn't pass. It just actually passed in 2022. So we are relatively a brand new AHEC. We're about in our first year. But if you look at the map, you could see we basically serve 22 different tribes in Arizona. We've got Navajo and Hopi up there. We've got the Wallapai and the Havasupai. And then if you go down in the middle, we have San Carlos Apache, which is kind of lined. And then over to the left is Gila River Healthcare. And so those are currently our 2 partners. And so because we're a non-clinical agency, we have to partner with tribal entities. And so we have partnered with them to help us carry out all of our activities that we'll talk about later. But you can see, and what was really kind of beneficial for us is that for the longest time, and AHECs in Arizona did always, represent the underserved and the various native communities. But this was the first time when the American Indian Health AHEC came on that they actually listed all the tribal nations on the map. So again, it's those small steps that we're taking to, ensure that we get the services and the AIH program out to our tribal communities. And our local regional Arizona AIH is down in Tucson, and I believe they're part of the University of Arizona's medical school. So they fund us and keep us going. But yeah, we are relatively a new AIH, and we're very excited to be involved in this. So thank you.
Yeah, hi everybody. I'm Grace Behrens. I'm a project coordinator at the Montana Office of Rural Health and AIH. I'm here speaking on behalf of several of our staff who work on a lot of the programs that we'll be highlighting today. A little bit about our office. We're a little bit unique in that we house both Montana's State Office of Rural Health and our AIH program office. So like Gloria mentioned, we also do not have a medical school in Montana, and so we're housed at Montana State University's College of Nursing in Bozeman, Montana, which is this red star. We have 5 regions in Montana AIH right now. So first, kind of working from west to east, our Western Montana AIH in red, housed at Shout out to a couple of our colleagues who are on the call right now. We also have our North and South Central AIH regions. They're both housed out of the Montana Hospital Association in Helena in, tan and green. And then our Eastern Montana AIH region is housed in Riverstone Health out of Billings in blue. And then finally, our Northeastern Montana AIH in orange, housed out of the Montana Health Network in Miles City. So we are trying to follow in Jeff's footsteps and create an American Indian AIH Center as well. So we have opened an RFP last fall, and we're currently reviewing the applications for what would be our second statewide center focused solely on American Indian health education.
Thanks, Grace. And I would love to learn from these two and do something similar in Alaska. So this is part of the reason we love to work across state lines and learn from each other. Really wonderful ideas. So earlier, I shared that we were going to share our work with you all through examples. But before we get to that, I wanted to make sure that you all really understood the 3 main goals that are set for AIHECs by the feds, by our funders at HRSA. The first is engage. We want to engage with students. And the reason why we want to do this is because we want to improve diversity. We want to prepare a diverse and culturally competent workforce representative of the communities we serve. So in order to do so, one of the main things we do at AIHECs is career pathways. We really work hard to work with youth from rural and underserved communities and get them interested in healthcare careers, expose them to the potential, get them thinking about what it might look like for them to pursue that type of a career path. The second main goal you'll see under the train section here is distribution, where we want to improve the workforce distribution throughout the nation, particularly among those rural and underserved populations. We know that most healthcare students are getting trained in urban centers. They're getting their clinical hours in urban centers. So when it comes to practicing, guess where they're going to practice? In urban centers. Our goal as the AIHEC is we really want to give them that exposure during their training, and we do so via the AIHEC Scholars Program. Every AIHEC has an AIHEC Scholars Program, and the goal of that Scholars Program is to provide community-based experiential learning for those health profession students in rural communities. That's where that community academic partnership really comes to play. And then the final area is retain. We've got to keep the providers that we have, and we do this through practice transformation. We want to develop and maintain a healthcare workforce that's prepared to deliver high quality care in a rapidly transforming landscape, which you all know. And the main way that we do that is through continuing education. And we'll give you some really great examples of what that looks like, specifically working with our partners from tribal communities. Okay, so I'll start, and I'm going to give you an example from Alaska of what we do to engage. And then I'll hand it off to Jeff and Grace, and we'll each kind of give you an example from each of our respective states for each of our goal areas. So in Alaska, one of the things that we're super proud of is our Della Keats program. It's named after Della Keats, who is a traditional healer from the Kotzebue region, who really spearheaded a lot of the expansion and the integration of tribal health, of traditional healing practices in the Western system. She was a legend. And what we've done in her honor is partner with the WWAMI School of Medicine to utilize a summer program that will expose students from rural communities to college education, to the dorms, to being on a campus, to being outside of their home community, to concepts such as anatomy and physiology, behavioral health and mental health, certificate training, all sorts of different things, job shadowing within the tribal health system, at South Central Foundation here in Anchorage, or at the Alaska Native Tribal Health Consortium. So we really try to embed as much as we can in this jam-packed program, which prioritizes, of course, students from our rural regions, our Alaska Native students that we've been working with out in their communities. We also have another program that is newer than the Delegates program. It's called the Rural Health CTEPs, and some people that see the word CTEPs might be familiar with it. It's not something that the AIH-AHEC has created. It's a Department of Education terminology. Department of Education, through their career and technical education programs, they have these CTEPs, which stands for Career and Technical Education Programs of Study. And a lot of times what we see is that these programs of study do not exist in our rural communities because we do not have the capacity or the expertise of career and technical educators in that community. It's hard enough to retain our K through 12 educators for traditional classroom study, let alone a specialized instructor that has that health science experience. So what we try to do there is we bring that specialty to those rural communities. Right now, we're partnering with over 15 school districts throughout the state of Alaska, and it's continuing to grow. And we only have so much funding. So it's first come, first serve. We work with you. We try to continue to work with those that we have funding to work with. We have a 4-course pathway where we go out and we provide 1-week intensives to these students. They earn dual credit. They earn industry recognized credentials such as basic life support, teen mental health first aid, bloodborne pathogens, those types of certificate trainings. And then they also have the ability from there to come to capstone courses at UAA, where they can become trained as emergency trauma technicians, learn professionalism, healthcare skills, and do job shadowing here in Anchorage. So those 2 programs are just 2 examples of some of the things that we're doing to engage. And again, they would be nowhere without partnerships. Our school district partners are essential to all of these relationships that we have in these communities. I'll stop there and I'll hand it off to Jeff to give some examples. Oh, sorry, I guess it's Montana next. I'm getting out of order from the slides, from how we were. So I'll hand it off to Grace. If you can give some examples from Montana, that'd be wonderful.
Thanks, Gloria. So the example I'll give from Montana today is a Heads Up camp we hosted in Rocky Boy last year. So a little bit of background: Heads Up camp is a camp for high school students to introduce them to behavioral health professions. And we do this through hands-on activities, simulation training, and by listening to presentations from behavioral health professionals from your community. I think Heads Up is really interesting because a lot of times when you talk to young people about going into healthcare as a profession, often what comes top of mind is like becoming a doctor or becoming a nurse. And while those things are super important and we need lots of them, there's also other ways to pursue healthcare, and it's important that we kind of expose students to all of the other things that we need. And in Montana, behavioral health is a very, very large need. So we hosted a Heads Up camp on the Rocky Boy Reservation last year, and we had 213 students participate, ranging from 7th to 12th grade. We also had another training up in Rocky Boy that kind of dovetailed with this training, which was a youth mental health first aid training. Youth mental health first aid is a training for adults who intersect with young people often to kind of learn what to look out for in the young folks that they work with, and how to help them if they do have a mental health crisis. And so we hosted this training in Rocky Boy as well. And we had 8 adults participate from Rocky Boy, all of whom were Rocky Boy School District staff. So it was a really awesome event, and we were able to reach a lot of people in a really short amount of time, actually.
Thanks, Grace. And I actually love seeing that you guys are still doing the Heads Up camp. I don't know if you are aware, but the core content from that curriculum actually started in Alaska. So we shared that content, another example of how we love to share across state lines and really work together we were hearing the same things that Grace was hearing. We need more behavioral health providers. So we really dove into that and created some curriculum to get kids excited about those types of careers. Jeff, I'll hand it off to you to give your Med Start Health Careers example as well.
Sure. Thanks, Gloria. So in Arizona, all of the 6 AIH-AHECs participate in the Arizona Med Start Health Careers program. And that is a program that actually this year is celebrating its 50th year in Arizona. And it basically, it's an 8-week camp. It's a pretty extensive application process. And these are juniors going into their senior year of high school. So they also enroll and do dual credit. They do multiple site visits to various locations throughout Arizona. They go up to the Hopi Health Center and they get some cultural training up there. We're also doing a site visit to Gila River Healthcare this year for these students. It's about 50 for the program. And this was our cohort. This picture is our cohort last year for the first American Indian Health AIH. The other two, real quickly, that we are participating in is Gila River Healthcare has a summer scrubs program, which is also a 6 to 8 week course for high school students. And then San Carlos Apache Healthcare runs a summer students program, which last year we had close to 90 students participate. And so, again, we also look for additional partners each year. And as some of the staff know, I think, who are on the call, we're going to be very busy this June with all of our youth programs. But it's a very good program, and it's celebrating its 50th year. So those are just a few of things we do.
Thanks, Jeff. Yeah, our busy season is quickly approaching for everyone. I feel you. Okay, so next up, we get into that train category where we're working with current health profession students. And really that whole premise of the train element is the AIH Scholars Program. That's been the big push from the federal level to AIHs, is to really formalize our work with health profession students, and the AIH Scholars Program is exactly how we do that. If you see that logo, I put it here because I'm really trying to help embrace that recognition. We are also giving out digital badges for our AIH scholars across the nation as well, so that we want this to be a much more visible sign for a lot of our community partners, that if someone has this AIH Scholars logo on their resume or their LinkedIn page or their signature line, it really means they have a special interest in working in rural communities. They want to be a healthcare provider in rural communities. So the more that you are familiar with that, I wanted to kind of highlight that. We want you to know that these AIH scholars receive this very refined understanding and extracurricular learning opportunities and experiential learning opportunities in rural communities throughout the nation. So some examples of how Alaska is partnering. First off, our tribal colleges, all of their health programs are eligible to be AIH scholars. In Alaska, we really had to cast our net pretty darn wide when it came to disciplines, because we just don't have as many people. And to meet our federal requirements, we really had to make sure that we included as many health programs as possible, which isn't always the case for every AIH. With larger populations, you can hone in on certain disciplines. But for us, it was like, we need to cast the net wide, and we did. So community health workers, community health aides, and community health aid practitioners are all eligible to be AIH scholars, which is a great opportunity for them to get even more specialized training and support and promote rural health, really, for students. So a lot of our students in Alaska are attending the University for College of Health programs at UAA in Anchorage. They don't necessarily get to see what things are like in rural Alaska, and their lack of exposure will result in a lack of them applying for those positions or being interested in those positions once they graduate. So we kind of look at this twofold. First off, we want every rural health program student to be an AIH scholar, because they're already out there in rural Alaska, and they're our best bet at staying out there in rural Alaska. So we really do a lot of work with our rural community campuses. And we try to get all their nursing students, for example. There's not many health programs in those communities, but we do have nursing programs. So we really try to get those students engaged as AIH scholars. The other thing that we do specifically is we want to place our students that are Anchorage based. When we do these community immersions, we want to place them in tribal facilities. And it's been a really great relationship. I'll give you an example from our Norton Sound Health Corporation, AIH-AHEC, that's out in Nome. They're looking at it, their corporation is looking at it as a recruitment opportunity. They warmly welcome these students to come. And the students aren't doing formal clinical hours so much. It could be that they do formal clinical hours, but for us, it's more about the community exposure than it is about the clinical exposure. What we really want those students to see is, what is it like in Nome? How's the community in Nome? What do you do for fun in Nome? That's the kind of things that sell a place like Nome. That's the kind of things that will make them think about going back there when it's time for them to practice. So we work really closely with the community. We've had host families, host students, take students berry picking, take them out on the river, take them out hiking. Like, those are the kinds of things that are done. So it's not really like the classroom is where it ends or the clinical environment's where it ends. We really try to get those students exposed to the community, to the place, to the way of life, and try to sell them in that way, that we have to recruit, we have to get more people. Even if we had every rural student go back and practice, there's still not enough providers in Alaska to meet the needs. So we have to really open up that lens in what we're doing to attract people to work in these communities that are really interested. And I think that's what I want you to think when you look at that AIH Scholars logo. When you see that, it's a symbol that this student really cares about rural health. I'll stop there and I will hand it off to Jeff to talk a little bit about how his AIH Scholars program is working in Arizona.
All right. Well, so, and what's really interesting, so in Arizona, we have what we call the rural health professional practices. So there's, I believe, 9. We have nursing and PA, NP, various through our 3 major universities, U of A, Arizona State University, and then Northern Arizona University. So we get a cross discipline of graduate students, and actually we opened it up to undergraduate students this year for the NAU public health program, because we do have a lot of Indigenous students doing public health at NAU. So very cross-cultural, cross-discipline. We have PAs, we have physical therapists, nutrition, public health, medicine. So our first immersion, we went down to Tohono O'odham, which is a tribal nation down south near U of A, Tucson. And they were able to get a little bit of a instructional introduction to the tradition, and we went to the museum down there so they get some culture. Then we also went to the Cells Hospital where they got a little bit of a tour. And then what was really interesting, so that whole immersion, and again, they're writing about this and they're doing their windshield survey. The second time we went down, because it's a 2-year program, so we're on year 1, was in February. And the Tohono O'odham Nation actually was having their big rodeo and fair and community events. And so they got to be immersed in that. And it was just amazing how much they learned about just the culture and just the community just from that interaction. So it was really an excellent immersion for them. They also do monthly seminars with our faculty mentors. And so this next September, we'll have them come back and do their 2nd year down in Tohono O'odham, and then we'll have another cohort start in September, and we're going to look for a community there. But what we found is this: it's really just a great group of students who really, when they get together, and we had a talking circle after our last one, and they shared what they learned, and they shared, kind of what they brought away from it, and it really was. It was inspiring to see what they gathered after that last immersion in February. So it's very exciting. It's very time consuming as well. But it is a great program, and it's something that, like I say, our first year, and so we're looking for our 2nd year. Tashina Mashane is our person who kind of runs this program, but that's our scholars program.
Thanks, Jeff. And Grace.
Sure. So Gloria does such a good job talking about what AIH Scholars is and what the goal of AIH Scholars is. And so I'm going to provide kind of a Montana example. I'm going to be talking about Journey Erickson. She's this, the top photo, the young woman on the left. She's from Wolf Point, Montana, which is on the Fort Peck Reservation. and she is an AIH-AHEC scholar. She's a BSN student, and she's also part of our mobile health training program. So she's a very busy young woman. So Journey shared this photo with us, and then she also shared a quote that I'll read to you all about her experience in AIH-AHEC scholars. She said, "Being an AIH-AHEC scholar gave me the opportunity to go to the Northern Cheyenne Reservation in Montana and help with health screenings for children at Head Start. It has also granted me the opportunity to go to Washington, D.C., here she is, and advocate for rural health across the nation, as well as providing numerous resources to further my education in rural health needs. I'm so thankful for all the opportunities they have given me. I hope to take this knowledge to help rural areas in the future." And so Journey is just a really good example of all of the different, I guess, perks of being an AIH-AHEC scholar. So I'll talk a little bit about the placement she referenced. So we have a program called the Mobile Health Training Program, and it supports undergraduate student nurses like Journey to complete clinical rotations in rural and tribal communities. And just like Gloria has been mentioning, this is done through partnership with mobile clinics to do federally required health screenings at Head Start across Montana. And so the sites our students go through the mobile health training program are Northern Cheyenne, they go to the Flathead, they go to the Blackfeet Nation, and they also go to the Lodgegrass School on the Crow Nation. And so like I mentioned, they do the federally required health screenings for the kiddos, and then they're also partnered with Smiles Across Montana to do dental screenings that kids can opt into, kind of bringing in that interprofessional lens that AIH-AHEC Scholars is all about. And then at the Northern Cheyenne Reservation specifically, we can place DNP students who can do other types of screenings as well, like sports physicals. And so the goal of the mobile health training program and its partnership with AIH-AHEC Scholars is kind of twofold. First is to provide Indigenous students with additional opportunities for clinical rotations across Montana that otherwise they may not have had. And second is kind of what Jeff and Gloria have been talking about, is exposing students who don't come from a tribal or rural background to different communities and how enriching and beautiful those communities are, and encourage them that after graduation, you don't need to go work in an urban center, you can come work in a more rural area in your state. So thanks.
Thanks, Grace. And the one thing I want to just end with this AIH-AHEC Scholars piece is, when it comes to partnerships, and I think the Head Start example is a beautiful example. We very similarly work with Head Start as well. It's really hard for a rural community to meet the federal standards for Head Start funding when you don't have health providers in those communities to run screenings. So it shows the community need, and then how the AIH-AHEC Scholars can help support that. And it's a win-win because they're getting that experiential learning, and we're providing a support to the community that they would not otherwise have. And the reason I want to highlight that is all of you might have examples of this in your community where you wish you had more manpower. You wish you had more boots on the ground. You wish you had support from the university or from academic projects or academic programs. Like, there are areas where we can bridge those gaps and utilize our AIH-AHEC Scholars to help with some of that manpower. And I will say, the AIH-AHEC Scholars love to give back when they're there. They don't want to go and be a suck on the system that they know is already super taxed with workforce shortages. So if we can give them something that they can contribute. Another example, in Alaska, we do Project Hope, which they create Narcan kits. They build Narcan kits with the community and then distribute those and train community members in how to utilize those. Those are the students that get to do things like that really feel much more value and much more supported, in that they didn't just go and feel like they were more taxing on the system that's taxed. Instead, they felt like they were contributing. So I hope that sparks some ideas, because I don't know all the needs of the communities. You all know what the needs are in your communities, and how can we bridge those gaps and create these really beautiful synergistic opportunities for our students and for your communities. So just something to think about as we talk about the train category here. And then the last piece that we'll jump into, and we'll have plenty of time for questions, is retain. So the real goal of this is to provide ways to retain our current workforce through continuing health education. So I have an example here that I'm going to share. At our last steering committee meeting of our statewide stakeholders, the Alaska AIH-AHEC program was really trying to figure out what topic areas are of greatest need for our tribal health entities and our tribal communities. And one of the things that came up out of this discussion was we really need to expose healthcare providers to the value of embracing traditional healing practices. So we really took that suggestion from our statewide advisory committee and we ran with it. But the next year, which was this academic year, we were able to select traditional healing as our interprofessional education topic for the college, so that all students throughout the College of Health were exposed to traditional healing practices. We ran a Grand Rounds event for students, and then simultaneously we worked on continuing education for current providers. So this little flyer that you see there in the center, we held a pre-conference workshop as part of the Alaska Public Health Summit. We knew that there were a lot of providers already coming in for that, so it was a strategic partnership again, that we weren't reinventing the wheel, but people could come in a day early and get this content without having to break their budgets of having to travel all the way in from these rural communities again. So we were pretty strategic there. We also recruited traditional healers from across the state. We had, I think it was 12 traditional healers that took part in this event where they shared their practices. You could see that photo on the right-hand side here. This was like a sensory table that was set up with all sorts of traditional herbs, and there were traditional tea service. There was all sorts of sharing that happened at this event. And it really was the arts of traditional healing and a very interactive sensory experience for all of the participants. So not just talking about this, but actually practicing some of these things so that the providers could better understand what these practices meant to their patients. And it was a very, very, very well received event. Unfortunately, there was a snowstorm on the same day. So we had pretty good attendance. I want to say we had 45 people out of 100 people that were registered, but because there were people that couldn't get in because of the storm, there were people that couldn't get out of their driveways because of the storm. So we were still pretty happy that we had the attendance we had, that people trekked through the weather. But it was a really great event that helped highlight and spotlight and really lift up some of these practices and open up the minds of providers that might not have otherwise understood or really experienced this, to see the value that traditional healing practices have for their patients. So we are rolling with this, continuing this. One of the wonderful things about this was that we gained a cohort of traditional healers that love working with us and want to continue to work with us and have been coming up with really good ideas and innovations of how we can continue to grow off of this first step. And we continue to embrace those partnerships and work with them moving forward. So that's just an Alaska specific example. And there's plenty more. One of the things that these traditional healer groups are now working on is an asynchronous cultural foundations course, so that providers that are itinerants can take this before they even get to Alaska and really set the foundation of their understanding of culture in Alaska before they go out to serve in some of these communities. So again, in partnership with our partners throughout the state, we've received a lot of feedback towards that course, and we're hoping that it's going to launch next month. Right now, we're in usability testing for that course. All right, I will hand it off to Grace.
Thanks, Gloria. So the example I'm choosing for Retain is a program called Pathways of a Messenger. And so this is a training program for Indigenous community health workers that our office developed in partnership with a health education nonprofit called Messengers for Health, which is located on the Crow Reservation. And so our office has a community health worker curriculum, and Beth Ann Carter from our office partnered with Alma McCormick, who's the CEO of Messengers for Health. And Alma went through our curriculum and then she infused it with Crow specific content and knowledge that she felt like her community would need for a community health worker training. And so Pathways of a Messenger has been in existence for a few years now. And now Alma is going to other tribes around the nation, kind of presenting the curriculum to them and saying, hey, anywhere that you see Crow content, substitute it with your own so that your own community can use this tool. So that's kind of in the works right now as Alma is meeting with folks around the state. When all is said and done, the training will be approximately 40 hours and it will be in person. And her hope is that she'll have an Indigenous master trainer that will be able to travel to different areas around the state and partner with each individual tribe to get more community health workers trained around the state.
All right, and Jeff.
So for the American Indian Health AIH-AHEC, we are still, as I mentioned, kind of in our first year. So we're still developing our CEU program, although we do also have another program within our American Indian Health AIH-AHEC. It's called AHEAD. And what that is we actually will provide training, will fund training and or certification for Indigenous healthcare workers in the event that they can help advance their career and also have an impact on the community. So for example, we've had a lot of individuals who wanted to become certified pharmacy technicians. So we were able to help them with their funding to get that program taken care of and get them certified. We've had nurses, community nurses want to become SANE certified. So again, helping them with that didactic training and helping fund those. So that we're hoping will also kind of help not only keep them in advancing their career, but also kind of also impacts their community and what they can provide to their community. So we've been doing that program, and it's not typically an AIH-AHEC program. It's just kind of run through our program, but that's what we've been started so far. And I think since probably, oh gosh, last July, we've done over 80 individuals with certifications that have, again, changed their careers and changed their lives. So it's a great program, and hopefully we'll get funded for it again next year. But and then we'll get our continuing education going. It's a very involved process, as we found out. So.
Oh yeah. All right. So we'll just open it up now for some questions. And I think there are some in the chat. And if anybody else has others, we'd be happy to answer your questions.
Yeah, well, thank you. Thank you to all of you for presenting today. We do have a couple comments and questions in the chat. We'll go through those first, and then anyone who's here, just feel free to hop off of mute and ask any additional questions you might have. Kathy in the chat indicated some interest in partnering with each of the groups you all mentioned, and that they do virtual programs for infants through graduate school. And this includes helping to train the trainers. She also, down a little bit further, addresses an ebook that she recommends we all search, Minority Parent and Student Guide, subtitled to Academic Success and Career Entry. And she provides contact for herself in that, so that is in there. And then she has a question: what is the best way to pursue partnerships with each group?
It's a really good question, Kathy. And one of the things that I wanted to bring your attention to, you probably see the National AIH-AHEC organization logo here, and nationalahec.org, this website down here. I strategically picked that instead of trying to piecemeal together all of our individual contacts, because if you want to get in touch with any AIH-AHEC in any state that we have AIH-AHECs, the best way to do so is to go through the National AIH-AHEC organization. They have easy contact. At least once every week or so, I get some type of a message from the National AIH-AHEC organization connecting me that, oh, there's a potential AIH-AHEC scholar interested in programming that's in Alaska. So they have a lot of different forums on their website to get connected to your local AIH-AHEC, whether that's your AIH-AHEC center, which would be your region, or the AIH-AHEC state program office, which would be the whole state. Either one of those, they can get you in contact with the right people to start discussing those partnerships. And that would probably be the easiest way. I can also include my contact information for those of you on the call that are here in Alaska, and I'll have Jeff and Grace do the same for those of you that are here from Arizona or Montana.
Wonderful. And then she did have a follow-up question. Does the AIH-AHEC Scholars Program offer avenues for individuals in various health careers continue on into other health careers, such as going from community health workers into nursing or medical school? So
that's definitely the goal of some of the programs. As I mentioned earlier, some of the AIH-AHECs really focus on those higher, like graduate level programs. Every AIH-AHEC has a different list of disciplines depending on their state. So you really have to talk to your specific AHEC to see whether your AHEC program accepts, for example, community health aides. For example, those ones for us that we go out of our way to working with those rural students that are out there in those rural communities, we do want to continue connecting with them. I've had an AHEC scholar that started off as an undergrad in an associate's program, and then she became an MPH student and went and worked with us again and became an AHEC scholar again in a different program that she was enrolled in. So it is possible for them to kind of continue on. What's limiting sometimes is the capacity. We have a lot of energy surrounding doing the outreach work and doing the programming, but some of us lack some of the capacity to do that follow-up, and those long-term tracking strategies, they become more difficult. We are required to track our AHEC scholars for at least 1 year, and many of us do it for more. And what we've been starting to find, like, just note the program didn't start until 2018 officially. There was a planning year in 2017. So the AHEC Scholar program is fairly new in comparison to the AHEC program as a whole, which has been around since the 70s. But what we're seeing is that there's pools of AHEC Scholar alumni that are growing. And there's definitely this captive audience of folks that have been through the Scholars program that even at the national AHEC level, we're trying to figure out how do we continue to work with them and engage with them beyond the time that they're with us as scholars. So I think that's on our radar, but it's definitely a work in progress.
Great, thank you. So a question from Loretta in the chat: to what extent has anyone included traditional healers, such as ceremonies as told by healers, discussing ceremonial aspects such as how songs are healing, how the ceremonial protocols contribute as a necessary and sufficient means of healing and quality?
I shared my example, so maybe Jeff or Grace.
I'll speak to that. I think we've done a couple of things like that. So in our immersions, we did bring in a healer to do our blessing, and then also in our second session, he did a cultural humility training, and so went through it and really kind of educated the scholars on that. And so we are slowly integrating them into that because we do believe that that needs to be incorporated, because that is another piece of what the American Indian Health systems is all about. So we do incorporate that. We're also working on a training for our college students that go do clinical rotations, that they do a cultural humility training before they go. So we are incorporating that to kind of educate people more on our various traditions and ceremonies.
Wonderful. Okay, so we have a question from Reno. Do your retention strategies include addressing housing shortages on reservations, perhaps lower salary compared to urban work opportunities that is of special concern to students who have a high student loan burden?
Sorry, I'm looking for the question. I was chatting in the chat box and missed the question because I was trying to respond to a different.
It's right after you all posted your email contact, but I can read it again. Also, do your retention strategies include addressing housing shortages on reservations, perhaps lower salary compared to urban work opportunities that is of special concern to students who have a high student loan burden?
Yeah, I wish that I had the funding and the capacity to tackle the things that are mentioned in that question. Right now, I 100% agree. Housing shortages are extremely difficult for us to even just get exposure opportunities, let alone fill those workforce vacancies, right? So we definitely see that as a problem. Right now, our AHEC in Alaska does not have the capacity to try to tackle any of those issues with housing, but we certainly advocate and support those organizations that are doing so. One of the things that we are a part of that's a retention strategy, it's not specific to housing, but it's loan repayment. We really try to promote loan repayment opportunities, like the SHARP loan repayment program in Alaska is our state-specific loan repayment program, but there's also the Indian Health Services loan repayment program and the National Health Service Corps. So we really try to get the word out and advocate with our students that this is an option for you. If you do have lots of student loans, we also advocate for scholarship programs that can reduce those student loans. So we're not in and of ourselves facilitating or administering those programs, but we do try to support them and advocate for them as much as we can.
I'll add too, so we're in the same boat in Montana as they are in Alaska. We don't have the budget to address the housing issue. However, when we do work with tribes who have kind of solved some of that issue themselves, we like to promote that to people who may be interested in working in that area. So for instance, Fort Peck recently 638'd all of their dental services to the tribe. And so they have a lot of openings right now. They have quite a few dentists, but they really need dental hygienists. And so when we were up in Fort Peck a couple of weeks ago, their tribal health director let us know that they have housing there for hygienists specifically. And so then it's just kind of a matter of connecting the dots and visiting with our dental hygiene schools in Montana and saying, hey, if you do want to go work in Fort Peck, first of all, they're paying a lot to get people out there. And second of all, they do have housing specifically for dental hygienists. So that's kind of one way that we've tackled that issue.
Okay, a couple more questions in the chat from Gilberta. Is there scholarships available to students to attend higher education? Is there a Mount brochure available? And then question for Grace specifically, would you please share your Rocky Boy Reservation contact? Our Youth Development Coalition members may want to form a partnership in your services.
I love all these partnership questions. That's awesome.
Yes. Gilberta, will you please put your email in the chat and I can send you some stuff after the meeting?
And then in terms of scholarships, there are lots of different scholarships out there, but the Scholars Program isn't necessarily a scholarship. And I want to make that clear because there's variable funding from state to state and what's available. And some AIH-AHEC Scholars programs can provide stipend and travel support to scholars. Others don't have that capacity. It's very variable based on what budget each state has available. In Alaska, for example, we provide travel support for our AIH scholars. In other states, they may or may not be able to do so, but it's not a formal scholarship where it goes towards their tuition. It's more about their expenses for the experiential learning for us than it is about their tuition for their academic program. But there are a lot of scholarships out there. Just the Scholars Program is not a scholarship. So I just wanted to delineate that.
Yeah, I would agree. I wish we had the money, but there's just not enough money for the scholarships. But I think the AIHECs are a good resource. So, we get to share what's available and help them with application processes and the loan repayment program and such. One of our benefits in Arizona is, I'd say 75% of our funding comes from the state lottery system. So we get both state funding and federal funding. And so
I'm so jealous of you.
I know, and the lottery is never going to go away. So, but yeah, work that into your programs. It's very beneficial.
Jeff, can I ask you, when did that happen? When did Arizona get state funding?
I'd have to research that one, but I'm pretty sure it's been at least 10 or 12 years now.
Yeah.
Gosh.
Yeah.
Very jealous.
So it looks like we answered the last question in the chat. So I do want to open up. We have about 1 more minute. If there are any other questions, feel free to take yourself off mute and we can address those. Yes, Kathy, are you raising your hand? Yes. Okay.
I wanted to ask, and thank you. Thank you for doing this. This makes such a big difference. One of the big things, for example, I review things and do things for NASA periodically. I review their healthcare system and that type of thing. And so I'm on a lot of lists to get funding and things like that and for programs. And part of it, do you have a way that we could collaborate too with some of these other, let's say STEM type of fields, that you could have offshoots for building the interest in science and that kind of stuff, and then you can guide them. Like it's unique to do space medicine, for example, but my background was in family. Do you know what I'm saying?
Yeah, for sure.
I would love to work with you on that. And I've had as young as 21 months old in a space camp. And I designed a program called Project SMASH, Student Math and Health Science, and what is it? Science, Math, and Student Health Initiative. We didn't say smash it because we knew it would crack up. But I
love it, Kathy.
I went back 30 years later. I did this in Nebraska, one of the reservations in Nebraska. And 30 years later, I went back and all these kids had gone to college. I would love
that's
to
awesome.
be involved with you. I would love to help out. This is a passion of mine. So I put my little email there, and check out the Minority Parent and Student Guide. Is only $9.99. Don't drink a couple of cups of coffee out, but it has hyperlinks to programs for infants all the way through graduate school. And there are scholarships for all these folks. They're the 23 vetted scholarships for women, for example. I'm not biased.
And I noted all of your information, Kathy, and I certainly plan on reaching back out to you. I think one of the struggles that I've had when it comes to partnering with STEM specific organizations is there are quite a few, surprisingly, that do not want to include medicine when they talk about STEM. And I think it's part of National Science Foundation and National Institutes of Health drawing the line federally with funding. I'm actually part right now of a rural STEM workforce development national academies group that's we're going to be putting together a report specific to rural STEM education. And it's quite interesting because I'm there, but I'm like, I don't know that healthcare is going to be viewed as part of this, because it really does depend on who you talk to. I think at the local level, I've had great success. The Alaska Native Science and Engineering program, for example, you guys might have heard of it. It's called ANSEP. That program we partner with, we are their health strand. We are doing all of their health. They don't need to be the experts on health, and it's such a beautiful partnership. So I've had good success locally, but when I try to apply for NSF grants, you have to go broader than medicine and health. If it's health specific, there's definitely barriers, I would say. So that's kind of my take on it. I would love to do more in that space. I think it's more challenging on this level than it is at the more granular organic levels. But I really appreciate your contact info and your willingness to collaborate, and I'll certainly be in touch with you.
And I just want to say thank you. I don't want to stop anyone else from saying something, though, so just interject. One of the things that I would like to do too is, you probably have connections within communities. I helped, there was a design space technology curriculum, and I reached out to Montana and even pulled in, a propulsion, got the chief of propulsion from NASA to help out and all that stuff, but they don't know me, even though technically I'm a distant cousin, but my family were, they were adopted and different things out. So the thing is that I would love to talk with you about those connections, because that was almost $500,000. And even when they backed out after, even NASA wrote me personally and said, would you still help out? They wanted to give them the money. And I'm going, my God, your kids are having problems or unfortunately committing suicide and different things. And this is a way to get them excited. So I would like anyone reach out to me, because there are lots of different avenues of sneaking that stuff in. Like I belong to the American Indian Science and Engineering Society too. And my last major mentee with that was, she's now studying neuroscience, got an NIH, she's getting an MD PhD, so talk.
Yes, thanks, Kathy.
All right, well, I think that's going to be it for today. Grace, Gloria, and Jeff did provide their emails in the chat, so I think they are very open to receiving any additional questions or comments. I did just want to, Jeff, Gloria, Grace, if you have any last comments before we go. All right.
Thank you all for your time. Appreciate it.
Yeah, well,
Thank you, Gloria, for looping in Jeff and I in this.
Yeah, no, this was good to share. This is good.
Excellent.
Well, we are so appreciative to you three for being here and presenting to us, and to all of you here joining us and supporting the work that we do at our AIH-AHEC, AIH-AHEC. We are very grateful. Please look for more of our health webinars to come. We've got more on the agenda, so we will see you soon, and thanks again.